Good morning, everyone. Can I ask everybody to find their seats at this time? And while you're finding your seats, I'll just give you some announcements. One, I have, when tweeting or posting on social media, please use the hashtags, hashtag MOH, hashtag CARE, the CAIHR, or hashtag JHLS3. And just to advise you that we are live streaming on MOH website, www.moh.gov.jm, and MOH Facebook page, Ministry of Health, Jamaica. Yes, I feel like a true MC when I make those announcements. Just to advise you as well that if you've seen the program, it's very intense. We don't have time for you to take your calls, so we know that you're all very important people and you can't turn off your phones, but we're asking you to put them on silent, put them in front of you so that you can see, and then perhaps you could step to the back or step outside to take your call. Also want to advise you that the bathrooms are straight behind you, so if you need to use, it's right there. All right, so everybody's seated now, so good morning again, everyone. I am Jacqueline Bisesa McKenzie. I am the person that is sitting at the desk of the Chief Medical Officer currently. And I want to take this opportunity to welcome you on behalf of the Ministry of Health to this very critical sharing of information. This information that we're going to receive today will have significant impact on the health of our country and our economy as well. It's going to have a significant impact on how we direct our policy and programs within the Ministry of Health if it is that we want to achieve a healthy population. I have seen the results briefly, and it suggests that there is tremendous work to be done. And I have a sense of both excitement and trepidation when I think of the volume of work that this is indicating that we have to do. So I'm not going to waste any time. I am going to welcome Dr. Ferguson to open in a word of prayer. And after Dr. Ferguson, we have several important players who have made this possible. And I'm going to invite Dr. Hedwig Good from PAHO, then Mr. Duke Holness, board member of NHF, and then Professor Ian Boxill from the Deputy Principal of the University Mona, all very important organizations that have come together to make this possible, to make remarks following Dr. Ferguson.
Good morning, everyone. Let's bow our heads for prayer. Our Father and our God, we thank you for this day. We thank you for all the opportunities that are therein. We give you thanks, Lord Jesus, for your mercies, for your grace. We acknowledge your goodness, O God, and your faithfulness towards us. As we're gathered here in this meeting to share the findings of the Jamaica Health and Lifestyle Survey, I pray, God, that you will guide all our deliberations and all our actions. I pray, God, that you grant us wisdom. Cause that any decision that should be made, oh God, as it concerns the country and our policy will be directed by you and will be for the betterment of this country. We put our trust and our confidence in you as we say thanks today in Jesus' name. Amen.
Minister of Health, Dr. the Honorable Christopher Tufton, CMO, Dr. McKenzie, Professor Rainford Wilkes, Principal Investigator of this survey, National Health Fund, Mr. Duke Holness, Deputy Chief of the Min at UWI, Professor Ian Boxill, Deputy Principal, other participants, colleagues, invitees, members of the media, guests of very good morning. I'm very pleased to bring you greetings on behalf of Dr. Carissa A. Chen, Director of the Pan American Health Organization, and Dr. Tedros Ghebreyesus, Director General of the World Health Organization, at this opening session today. Please accept apologies for Dr. Bernadette Theodore Gandhi, the PAHO WHO representative for Jamaica, because she's on duty travel and can't be here. First of all, I want to start with congratulating the Minister of Health and the Caribbean Institute for Health Research of the University of the West Indies, who through collaboration were able to successfully undertake this work, and that has begun actually almost 20 years ago. And the importance of information for strengthening our response to health challenges cannot be underestimated. Congratulations also to all collaborators, including the National Health Fund, but also the people of Jamaica. Individuals, by participating in this survey, contributed to information that will allow health planners and decision makers to take evidence-informed decisions in improving health of the population. And of course, we know we are in need for different kinds of information. Apart from routinely collected data at health facilities, the Health and Lifestyle Survey provides other critical data for health planning and decision making. The gap in information related to NCDs was noted globally in most of our countries, and in 2002, the World Health Organization developed what has come to be known as the STEP survey, which is in fact a stepwise approach to the surveillance of NCDs. And this survey has been used in more than 100 countries worldwide. But here in Jamaica, this decision was taken to conduct the Jamaica Health and Lifestyle Survey. And with the first edition published in 2001-2002, and the third one launched today, this source of data has served Jamaica well and allows for the reviewing the trends in the burden of diseases and how these relate to lifestyle and risk factors. And that is really key, and I think that's really the strength of this survey, because most of the majority of our diseases nowadays are related to lifestyles. And we are all aware that the NCDs are among the leading causes of death globally, as well as in Jamaica, with accounting for 71% of all deaths globally, including also 37%, which is attributed to prematurely deaths between the age of 30 and 69, which are the productive ages for our people. So to address this global health problem, the World Health Assembly adopted in 2013 a global monitoring framework for NCDs with 25 key indicators to track the progress of countries. But also the 2030 Agenda for Sustainable Development, different from the Millennium Development Goals, also recognize now NCDs as a major challenge for sustainable development. And therefore there is commitment, including from Jamaica, to reduce the number of premature deaths. Okay, so we have been informed that this third health and lifestyle survey is, among others, estimating the current burden and risk factors for NCDs, and also assessing, and which is interesting, the burden of the chikungunya epidemic, that occurred in 2014, among other things, and that affected Jamaica so much. And we really think that combining the collection of data of communicable diseases and NCDs and lifestyle is really an excellent approach and will help you very much. This report is also, I want to know that this report is coming at a very opportune time. The Jamaica Health and Lifestyle Survey now will have all this data. And because in 2 weeks from now, later in the month, there is, will be the third high-level meeting on NCDs, when global leaders will look at the progress that has been made towards reducing the NCD epidemic. We all know that the Caribbean had lobbied for this attention and had the CARICOM leaders had signed the Port of Spain Declaration in 2017. So we really had a role in pushing this. But the third meeting that is taking place later in the year, of course, will also be used to have a call for more funds available to address the NCD epidemic. And with this survey, Jamaica will be in a good position to show the prevalence, the burden of the disease, etc. So PAHO, like all of you, look forward to the dissemination of these important findings so that it can be determined where to put more attention, as well as and have a good understanding of the burden of epidemics such as chikungunya on the health system, because it will be important to see how we need to strengthen the resilience of the system to ensure that while we are addressing outbreaks and things that in dramatic increase in demands for services, while we're doing that, to continue to address the NCDs and other health conditions. We anticipate that the use of this new evidence will be important in our technical cooperation. But last but not least, I really express the hope that dissemination of the result of this valuable survey will not end with us here today, but will be used to educate all and be used to enhance the ongoing social dialogue with non-health public institutions, sectors, with the private sector, with the economic sector, and with individuals and communities, and also going to be used because it can really be a tool and an instrument to strengthen partnerships for health across all and strengthen the health sector to build those partnerships, which is very much needed. We all know that adherence to medication is a big problem in chronic illnesses, and there's also evidence that family support is critical in improving adherence, even more than just what a physician is mentioning to the patient. So it will be very critical that this, the communication of the findings and the understanding of it and the role of everybody is there, out there for everyone. Thank you very much, and I wish you an engaging meeting.
Madam Chair Lady, Dr. Jackie Bissessor-McKenzie, CMO, Minister of Health, Dr. the Honorable Christopher Tufton, Minister of Health, Dr. Good, that we just heard from, PAHO, Professor Ian Boxill, Deputy Principal, UWI, Professor Wilkes, Founding Professor, Epidemiology and Director at the Epidemiology Research Unit here at UWI. Of course, I'd like to also acknowledge Mrs. Sansia Bennett, Permanent Secretary, the Minister of Health. Ladies and gentlemen, so it gives me great pleasure to bring greetings on behalf of the National Health Fund, NHF. We applaud the Ministry of Health and the team from the University of the West Indies and Caribbean Institute for Health Research for leading the efforts in the development of the Jamaica Health and Lifestyle Study 3, and of course, for the launch of the publication today. We do believe that this is a remarkable document and represents a significant step in understanding the true burden of those major challenges that we face in our healthcare system. The NHF is keen on removing all obstacles to health care, and an important part of this process is the identification of diseases and health challenges that are affecting our general population. This publication, no doubt, will assist in identifying behavioral practices and the healthcare trends that are affecting us as Jamaicans today, and will no doubt guide policymakers in developing appropriate measures to tackle the various challenges in the health sector. We at the NHF believe that health policies and practices must be grounded in the best scientific knowledge. They must be based on the evidence and the realities of the individuals affected. Therefore, I'm happy to say that the NHF fully appreciates and endorses this publication. Today, I'm delighted to say that we at the NHF were able to provide funding to the tune of $45.48 million towards this research. However, let me also underscore that the data which has been gathered is invaluable. In other words, it far outweighs the funding that we were able to provide. The NHF continues to fund research projects each year, for which I understand UWI has been a major recipient of such funds, so justifiably, or justifiably so. A key priority in our 5-year strategic plan is financing projects that positively impact the public health system. We do this through the institutional benefits arm of the NHF, which provides assistance in the form of grants to both public and private sector organizations. It's important for you to know that the NHF has provided funding to the tune of almost $13 billion since its establishment 15 years ago. In the last fiscal year, we approved 44 projects valued at $1.79 billion. And of this, $28 million was approved for health promotions and $54 million for research. As evidenced by the growing number of persons applying for NHF and JADAP cards, which, as you know, covers a number of non-communicable diseases, unfortunately, this epidemic is not slowing down at the pace that we're comfortable with. I think this is probably one of the reasons why our goodly minister has been promoting in a very aggressive way the Jamaica Moves campaign. At the end of August 2018, there are approximately 387,500 active card holders, NHF card holders, covering on average 3 disease conditions. The NHF is fully committed to Jamaica's mission to reduce diseases by 25% by the year 2025. And so we certainly do expect that the results of this survey will greatly enhance our shared response to the needs that are emerging. We will continue to support high-quality research that will move our strategic position for health forward. And once again, therefore, we applaud the NHF, the board, and all members of the NHF applaud the University of the West Indies, and we certainly look forward to seeing the translation of the research into tangible and effective solutions. Thank you very much.
Good morning, Madam Chair, Honorable Christopher Tufton, Minister of Health, Dr. Good of PAHO, Mr. Duke Holness, and Professor Rainford Wilkes, one of the university's distinguished scholars, and who I was told after this event is going somewhere off into the sunset. I laughed at that because we know that will never happen, right, Rainford? Ladies and gentlemen, I'm presenting on behalf of, I'm representing Principal Weber, who has a strong interest in this topic and these issues like I do, because we all know that at some point, many of the issues that you discuss will have an impact on all of us. And so what I'm presenting are his thoughts and his greetings to you. It is my pleasure to bring greetings at this third installation of the National Dissemination Meeting for the Jamaica Health Lifestyle Survey. The past 20 years alone have been rapid advances in human development, welfare, and culture. Social media in particular has been mind-boggling in terms of the dynamics and how it has changed and impacted how we live, how we work, how we communicate with each other. In the year 2000, Facebook, Twitter, and Instagram did not exist. Now, some of us can't imagine life without them. In the same way technology has evolved, so too has the state of healthcare and the issues that have been faced. While people are living longer, the rise of non-communicable diseases has not augured well for the quality of life. The national purse of countries across the world continue to be emptied by rising healthcare costs. In this era, one cannot speak of sustainable development focusing solely on traditional predictors. Right now, more than ever, health literally equals wealth. If we don't focus and act on reversing the negative trends in health, we actively compromise our ability to shape a society that will meet and exceed the needs of future generations. The Jamaica Health and Lifestyle Survey is a critical development. It is a critical development in the history of healthcare, not only in Jamaica, but in the region. The survey provides data for the assessment of health, quality of life indices, and expenditure in health systems. Important to note, the National Health Fund, which has helped thousands of Jamaicans to date, is a tangible outcome from the findings of the survey. Data from the survey have provided critical information for the creation of the National Health Fund and informed the Ministry's national policy for the promotion of healthy lifestyles, as well as the World Bank 2011 study on public policy and the challenge of chronic non-communicable diseases. The Jamaica Health and Lifestyle Survey is the country's largest health and nutrition study and continues to play an invaluable role in providing guidance to our practitioners and policymakers about healthcare management, the allocation of human and financial resources, and the evaluation of effective policies implemented for their management and control. The most recent Jamaica Health and Lifestyle Survey was conducted in 2008. Like you, I'm eager to listen to the report and review the most current findings. Our minister must be commended for taking a personal and passionate approach to the matter, literally moving our nation into health and wellness through signature public initiatives such as the Jamaica Moves campaign. And Professor Weber writes, Minister, I might join you on the stage, or for a workout. I'm sorry, I'm not. That is Dale. I'm not. Minister, I'm not joining you, so I'm sorry. I know the minister for years, and I know when he was very inactive, but since he's become health minister, he's learned all of the health professionals, the doctors, etc., have taught him how to live a better and longer life, and he's been bragging to me this is the best ministry that I've ever been in charge of, because he's learned so much. In all seriousness, many of the non-communicable diseases currently impacting our citizens did not develop overnight, and so we have to be deliberate, persistent, and proactive in our approach. We also grapple with change in culture. We've all seen the debate around the call for cutting sugary drinks, especially for our children. This survey continues to be timely and necessary. I trust it will be thoroughly assessed and the various action points extracted for us to collectively update policy and approach and craft new programs and initiatives where needed. To close, I wish to restate the university's commitment to the national project for health and wellness, and to congratulate all teams, stakeholders, and partners who continue to make this very important work possible. I thank you.
Thank you. A very special thanks to these, our partners, who have really enabled this survey and have made it possible for us to be here today. I just also want to recognize that there are several distinguished persons within the audience, and I'm not going to be able to mention persons by name, but I just want to mention the persons from the Ministry of Health Head Office and from the regional health authorities, and I recognize persons from the parish health departments and from our facilities, and several distinguished persons from the University of the West Indies. Welcome. Over the last 2 decades, the University of the West Indies and the Ministry of Health have worked in partnership to undertake this Jamaica Health and Lifestyle Survey. And the goal of this third survey was to estimate the current burden of and risk factors for NCDs, including intentional and unintentional injuries, HIV/AIDS, and other sexually related conditions, and chikungunya. The collaboration of the Ministry of Health and the University of West Indies in this scholastic venture that has seen the awards of many higher degrees and has also affected the implementation of many life-changing policies and programs is an achievement in itself. The university is recognized for its excellence in research, and through our National Surveillance Unit, Dr. Webster Carr at the head, we are moving forward with our own research agenda. Partnerships like this is an example of how we must collaborate to concentrate our resources in areas that will benefit the population. I am going to welcome Professor Wilkes, who is going to tell us more about the Jamaica Health and Lifestyle Survey. Professor Wilkes has played a very pivotal role in this survey, and I am anxious, just as you are, to hear about it from him. Professor Wilkes.
Thank you very much, CMO. Morning, ladies and gentlemen. Honorable Minister, Dr. Christopher Tufton, Deputy Principal, Univi, Professor Ian Boxill, Permanent Secretary in the Ministry of Health, Mrs. Sancia Bennett Templer, representing the Pan American Health Organization, Dr. Hedwig Huda, National Health Fund, who we've leaned on for the last several decades. Please take back our appreciation, Mr. Duke Holness. The research team, University of the West Indies and the Ministry of Health, which I will provide you with the names at the end of the presentation. I want to recognize Dr. Deanna Ashley, who is in the front here, who has been with us throughout. from the very first lifestyle survey and the survey which took place before that, which was headed by Peter Figueroa. Colleagues in the Ministry of Health and the University of the West Indies, ladies and gentlemen, welcome and thank you for being here today. I'm honored to present an overview of the health and lifestyle surveys over the last 20 years and to lay the foundation for, or the background rather, for what we are likely to hear this morning from the latest survey. By way of background, we all know by now, globally, the NCDs account for approximately 60%, it's probably more than that, of all deaths and 43% of the burden of disease. And the burden of non-communicable diseases in the Caribbean has escalated and now accounts for over 60% of the disease burden. Some of the leading causes of illness and death in developing countries, and in particular our own Caribbean. And a couple of decades ago, or just over a decade ago, the Caribbean Commission on Health and Development confirmed that cardiovascular diseases are the leading causes of ill health in the region. Coming out of all of those surveys, information, the Ministry of Health has in fact instituted strategic responses, which include promotion of healthy lifestyles. And part of our effort in this lifestyle surveys have been not only to measure what's going on, but to look at it in secular trend and see whether in fact we've been having the impact that we desire. In the words of Reddy and Yusuf, Reddy was a guest of the NHF in last year or this year. These 5 points are important strategies to deal with the chronic diseases. We need to have efficient systems to estimate the burden and the secular trends. Some might say that surveys like this are not efficient, they're rather expensive. You heard what NHF said, and that was 50% of the cost. We need to estimate the risk factors for these NCDs. Behavior plays an important role, and we need to find ways of identifying health behaviors, and I'll come to mention one addition to this survey in which we have tried to respond to that imperative. We need to develop a health policy which addresses the population-based approach to the diseases. And of course, we need to make efficient the approaches to those who are already afflicted. Jamaica's health profile has been dominated by the NCDs, as well as poor reproductive health practices. There are concurrent risks of infectious diseases, including, as we are all aware, the epidemics of mosquito-borne diseases, and violence and injuries, intentional and non-intentional. And these form the basis of our health agenda. So the overall aim of the Jamaica Health and Lifestyle surveys over these last 2 decades and more really could be summarized as to generate evidence for action, to improve the health of the nation and the region, to provide lessons for similar populations worldwide, and to build capacity and competence for local researchers. The surveys so far have been successful on both fronts, we believe. And this slide shows 2 important policy papers which have come out of the survey data. The Pan American Health Organization Country Cooperation Strategy was informed by these data, and the World Health Organization monograph on non-communicable disease in Jamaica, moving from prescription to prevention, is also informed primarily by these data. Among the 15 peer-reviewed manuscripts, and there are others in the pipeline as we speak, a few are shown here, and I will not elaborate on them. In addition, we've had 2 doctoral theses from the data which have been generated 1 PhD and 1 doctorate in public health. We've had 1 book on mental health related to, related to the PhD. We've had 10 master's theses in epidemiology and nutrition, and there are more as we speak coming through. This book launched, is it last year, Lee? Wow, time flies. It's almost a year now. Authored by Jasneth Mullings and titled Going Crazy in the City, Neighborhood Context and Mental Health, came directly out of Jamaica Health and Lifestyle Survey 2, done in 2007-2008. If we turn our eyes to the policy impact, you've heard earlier that the National Health Fund, when it started under Ray Barrett, was informed by data generated by this university, and alongside the lifestyle survey data of 2000-2001, we had some prior data coming out of the Spanish Town surveys, which began in 1993, which provided important data on the chronic disease epidemic, for which there was a hiatus from the 1970s to the 1990s, and that brought us up to date. Data for the diseases to be included in the subsidies were derived from these 2 sources of data, because money is never totally enough and priorities will have to be set. This, and I'm sure Diana remembers this one, the promotion, National Policy for the Promotion of Healthy Lifestyle in Jamaica, came directly out of the earlier of the two previous surveys. And just to summarize some points coming out of that policy, we agreed that it was important to create supportive environments. We're still saying that today, in trying to improve socioeconomic status, in trying to improve the physical environment, in trying to provide safe spaces, to pay attention to the cultural issues, and to incorporate them into whatever we are doing, and to make provisions for healthy foods. We committed that it was required that health literacy be improved, that behavior and awareness in all settings, schools, clubs, churches, communities, home, and of course in the health facilities. And we recognized that targeted lifestyle behaviors had to be integrated into the treatment program in all settings. Alongside that policy, this strategic plan was developed, and I want to recall the late Diana's brother, whose first name I can't remember right now, who was very integral to this strategy, which was developed back then in 2004. And just to lift a few of the points made in those strategies, the broad objectives included the same 4 areas that the CMO spoke about: chronic non-communicable diseases, violence, reproductive health, and the other I'm not going to remember right now. That's why I have to go, Ian. We recognize that increase in the number of persons who are taking part in physical activity, minimum of 30 minutes per day, the role of fruit and vegetable consumption, and the reduced fat, sugar, and salt. Those were all recognized in that strategic plan. Ensure the production and marketing of healthy foods. Now, that is an area which I myself wonder about whether, they've got the message. Reduce smoking, improve reproductive health behavior, and reduce risky behavior associated with violence. I apologize for the spelling of violence, which leads to injury and suicide. More recently, and one of our colleagues on the team, Dr. Trevor Ferguson, played an important role along with his Ministry of Health colleagues in developing the most recent strategic plan, 2013 to 2018, which espouses the following vision: healthy Jamaicans living in healthy communities and persons living with or affected non-communicable diseases and injuries, achieving optimal quality of life. Mission to facilitate opportunities for all Jamaicans to live a healthy life by implementing integrated whole-of-society actions to promote social environmental policies and systems improvement that support health in all. The goal of the strategic and action plan is to reduce the burden of preventable morbidity and disability and avoidable premature mortality due to non-communicable diseases and injuries by 25% by the year 2025. And some of the objectives recognized: reduce exposure to modifiable risk factors for the NCDs and promote and develop health promoting environments, strengthen and reorient the health systems to address prevention and control of NCDs through people-centered primary health care and, of course, provision of universal health care. And thirdly, strengthen the national capacity for NCD Alliance and high-quality research for prevention and control of NCDs. And we believe we have been trying to adhere to these objectives as we move along. Further, strengthen international cooperation and advocacy. The Minister is very convinced about that. Raise the priority accorded to prevention and control of NCDs in the development agenda and in the international agreed development goals. Build health promoting public policies through health in all policies. Strengthen national capacity, leadership, governance, all part of the WHO building blocks, multi-sectoral action and partnership to accelerate country response for prevention and control of the NCDs. These data are also important in providing information for our reporting responsibilities, which one of our senior health officials in the ministry, Dr. Tamu Davidson, is very, very insistent that we not lose sight of these responsibilities to report to our regional and international health agencies to contribute to the global health agenda and play our part in the overall worldwide response to the NCD epidemic. Over the last 25 years or so, we've been able to measure or estimate the trends in several disease conditions. And I've selected a couple, maybe three, to demonstrate today. I want to pay acknowledgement and respect to the first survey done in about 1993 under the leadership of Peter Figueroa. The one big difference about that survey is that the measurements were not made, and it was just what was reported by the participants. But even then, we had, in those data, for example, we had no estimate of the obesity epidemic. Apart from that, let's look at obesity as estimated by the last two surveys, 2000 to 2001. Obesity, 45.6% in the first one, and then about 9 years later, 51.7%. And my colleagues will let us know where we are today, as indicated by that question sign. In diabetes, one not surprised at the 4.1% in 1993, because we know that approximately 30% of diabetes are not reported and are survey detected. But in 2000, we made an estimate of about 7.3%. Many of these data are quite different between men and women, but these are overall estimates of both sexes. And in 2008, we reported a 7.9% overall, females more than males. For hypertension, 13% reported, not measured, back in 1993, but in the two reported and measured estimates that we made in 2001 and 2008, you can see that there is all this monotonic increase, 20.3% and 25.2%, and we await the findings today. Over the period, we have learned some lessons. There have been several improvements in data analysis, in methodologies to compute data, to collect data, in the recognition of the aging population. The previous two surveys were confined to persons 15 to 74 years old. I've earned the ire of my classmate, Professor Denise Eldemeyer, for doing that. And before I make my departure, I've fallen in line with our instructions. So this survey includes all persons from 15 years and older. We have developed geographical information systems as a science, and we have taken advantage of that to help us understand the good old-time epidemiology, as Winston, Professor Davis in the audience will record, the who, the what, the when, and the where. And now we don't need to ask persons. We can tell exactly where you're sitting or standing using all these techniques which have been developed. And we've worked very well with Mona GIS in adding this component to our competencies in measuring the burden of our diseases. We've paid more focus on men's health. A colleague from a urologist, Bill Aiken, has joined the team. And with our recent experience of the chikungunya and Zika epidemics, we have had to pay attention to the mosquito-borne diseases as a specific area. We already recall that at developing countries, one of the things that characterizes us is that we have a double burden of diseases. While we are facing this NCD epidemic, which is burgeoning, we also have some of the diseases of poverty, undernutrition, undereducation, low health literacy, and so on. We believe that we have built on the ethos of research that underpin policy, for which Jamaica is well known, and the university in particular, with institutions like the Tropical Metabolism Research Unit, have provided important data, and its successors, TMRI and now CARE, have provided important data which have informed health policy and practice worldwide. We are very pleased to have established this very vibrant and collegial collaboration between academia and health policy makers, including our international partners. We are confident in the reliability and validity of our data. We have incorporated qualitative methods to improve our insight into the numbers that we see. And we're very pleased to have on our team Dr. Ishtar Guvaya and her colleagues. Well, let's change that from 10 minutes to a couple of hours, and that will give us some time. Right. And today we share our findings, especially in the context of the secular trends in health over the last 30 years. We are concerned that the funding for this exercise remains insecure, and we look forward to some improvement in that area. The Jamaican Health and Lifestyle Surveys have made a significant contribution to academia and health policy. That was my title. This and other research efforts must be given priority in the national agenda. And here I pause to recognize that the Ministry of Health is in fact paying attention to this, and have been given the privilege so far, the last couple of years, to chair the Essential National Health Research Committee, which is paying attention to the agenda and the policy for health research in the country, and also represents another manifestation of the collaboration between academia and policymakers, as I share space with the national epidemiologist, the head of data research and analysis in the ministry, and several stakeholders across the society. So this is not a criticism. This is a recognition of what needs to be done, but let me publicly acknowledge that the Ministry of Health has been answering the call within the limitations of their various constraints. We're pleased to present these data today, confident that they represent the current situation and that they will provide further guidance required to move us forward. Having established this source of health data and built this collaborative team, we're optimistic that this enterprise will positively influence Jamaica's healthcare for the future. And I close by just leaving this slide up to recognize the team which has been integral in taking this particular survey forward. And I'd like to thank them for their support. You know, I accept the label that I'm miserable, so I'm not even going to argue with you about that. But they have rallied to the call. I hear it in every sphere of my life, at my birthday party, everywhere I go, I hear that. If I have one weakness, it's miserable. But the team has rallied to the call. I'm very pleased. I feel comfortable departing. I feel we have built a team here which is sustainable. And I think the competence has increased over the last several decades. And now I don't believe that this thing is likely to fall apart. And I want to thank them publicly for their support over the last couple of years. And as we move to fully exploit these data and to provide the responses to the various publics, policymakers, the peer-reviewed literature, the lay people in the streets, the NGOs, and so on, I believe the process is in safe hands. I thank you very much.
Thank you, Professor Wilkes. I think at this time, you've given a round of applause, but I think we should stand and give another round of applause for Professor Wilkes for the work that he has done, and I am sure will continue to do, despite him talking about departure. At this time, I just want to also recognize the presence of the media and to thank you for being here. We know that you support us when things are going wrong. We're happy that you're supporting us when things are going right. The Ministry of Health, under the leadership of our present minister, has made it clear that targeting NCDs is our biggest priority. I believe, and I'm sure that we all believe that for NCDs, we have the right minister at the right time. The minister has championed this cause, and as a health professional, I would dare to say, better than any other personal health professional or otherwise in this country in recent times. We have spoken, from Professor Will's presentation, this work has been going on for a long time, and a lot of work has been put in. But I believe, and I'm going to say it publicly, that the prominence that the minister has brought to this topic has really come at a time when it is needed, when we are in a time of preparation, especially with this survey and the work that was done over the last year, with all that is happening in our country and all over the world in terms of the rise of NCDs. We really do have the right minister at the right time for this. And as we prepare for the 3rd UN high-level meeting on NCDs, it is indeed timely that we are having this presentation now. I know that Minister Tufton is already charged for that meeting, and I know that he's anxious to let his thoughts be known, and so therefore, without further ado, I would like to welcome him to the podium to present his talk on this topic.
Thank you very much, Chief Medical Officer. Can I turn this down or? Okay, great, thank you. Dr. Hedwig Hoodie, did I get it right? Of PAHO, Mr. Duke Holness, board member, NHF, representing the NHF, Professor Ian Boxell, my longtime friend, UWI, deputy principal, representing the principal, of course, Professor Rainford Wilkes, the sort of champion of this very important exercise that we are all here anxious to learn more about and to essentially celebrate the importance of this piece of work, and your team, Professor Wilkes. Members of the Ministry of Health, represented by the Permanent Secretary, who is sitting in the audience, the Chief Medical Officer, and other very important unit heads, Dr. Webster Carr, who is a key connecting point with this work here at UWI. There are so many of you here representing so many different organizations, the Heart Foundation, UTEC, UWI, of course, PAHO, and I could go on, right? So you'll forgive me if I don't mention one or two of them. Members of the media, distinguished ladies and gentlemen, good morning to you all. I want to just add a few brief remarks, and be careful when a politician tells you brief remarks, okay? Because it could mean anything. But I understand that time is against us, and I know that you are anxiously awaiting the results of this very important piece of survey. First of all, I want to commend the team personally, and certainly on behalf of the people of Jamaica, for the work that has gone into creating this document, the third Jamaica Health and Lifestyle Survey. I had the opportunity last week to sit with the team and to go through the results just to get a thorough understanding of what the findings are and what the implications are of those findings as it relates to the health profile of our population, the possible actions that needs to be taken. I believe we sat for a few hours at least, right, Professor, with your team, and a few hours, right? And you know, it was really a learning experience for me, and I really feel empowered with knowledge in the first instance to lead the team, and for those who were there, I believe it was a worthwhile exercise. And what was very clear to me was that significant work has gone into what today will be unveiled and made public. And the team clearly placed a lot of effort, a lot of focus, a lot of time, and I think Jamaica will be better for it. So I really want to just commend them and recognize Professor Wilkes and the full list that he mentioned earlier for this piece of work on behalf of all of us, the people of Jamaica. I want to just mention two quick themes and a few points under it. The first one is connected to what I've just said, which is data and the importance of data as a critical component of developing and driving policy. You know, it was mentioned earlier about how much money is spent to put this body of work together, whether the NHF or other sources of funding. And we should make no apologies for this type of expenditure. And traditionally, government by far, I think, has the most data. And we collect data as a routine. Oftentimes, though, that data is never placed in a form and in a way or approach to mine the data and to get information that will allow us to make proper decisions that are grounded in important analysis. And so in this survey, what we can draw from and be motivated and encouraged by and learn from, even in our smaller spheres of our respective efforts, is that a methodology was developed that is sound and that is sanctioned, not just locally, but internationally. There was adequate data collection, and we have a lot of it out there. There was adequate data analysis, and that is something we need to build critical capacity in, and certainly would want to see us add even greater capacity whether at the ministry or otherwise. And the starting of a process here, which involves the important dissemination of that data. And that to me is also very important. There are a lot of times we do work and that work goes on a shelf and nobody knows about it. It really doesn't help anybody. In this instance, we are ensuring that the dissemination takes place. And I want to encourage all of us in this room, not just the media, but each of us in our respective areas to grasp as much of this data and the conclusion and disseminate as much as possible as part of the critical role of advocacy. So in public health, as is the case in any other ministry, we must always crave and be willing to indulge in data gathering, analysis, and dissemination. And the Jamaica Health and Lifestyle Survey, I think, is a great example to follow and to support as we go about doing other types of data mining to make sound decisions. Now, the thing with data is that it gives us a perspective, and a perspective that oftentimes can be justified around particular issues of concern. In this instance, of course, the NCD challenges that we face. And it requires of us as practitioners, whether at the policy level, at the clinical level, at the administrative level, to accept, once we have bought into the approach to that data collection, the conclusions that would have been drawn. And sometimes those conclusions leave with us very uncomfortable truths or realities. And we have to see our role as firstly ensuring that not only is the data disseminated, but it is disseminated in a way that stimulates action. We have to use that information to drive policies and programs so that we ultimately can make a difference. Otherwise, it's a theoretical exercise. We do it for doing its sake. It looks good, but after that, what happens? So you will hear, and I'm going to crave minister's privilege, Professor Wilkes, by mentioning one or two pieces of the statistic. Can I do that? I don't want to preempt the others who will come after me. But you will hear, to my mind, coming out of this Jamaica Health and Lifestyle Survey, and a lot of uncomfortable realities, truths, that depending on the perspective that you look at it from, or others who will hear about it, the discomfort may be greater for some persons than for others. It may be a personal experience, it may be a collective experience, depending on the organization or the entity that you represent. It is for us at this level, the guardians of public health, to use that data to ensure that the right thing is done. And we have a duty, a responsibility to provide public health best practices, guidance to the population. So what are some of the sort of uncomfortable truths that we have encountered and will encounter in mining this data, or in looking at the data that has been mined? We will see that 1 in 3 Jamaicans are afflicted or affected by hypertension. 1 in 3. We are going to see that 1 in 2 of Jamaicans are obese or overweight. That 1 in 8 Jamaicans have diabetes. That in terms of the chikungunya virus, over 70% of the population may have been affected, and 50% or just over that amount were affected sufficient to require medical attention. All of which can be further drilled down to look at issues of economic losses in terms of productivity downtime, cost to the public health system, pain and suffering of families and family members and associates. This has to be given sufficient attention to alert those that we serve, those we have a duty to respond to make the data worthwhile, so there can be at least some pause and self-reflection and analysis around the challenges that we face in public health. If we can't use this data to at least generate awareness in the first instance and reflection in the second, then frankly speaking, we're really wasting our time. And hopefully that's not why we're here. I'm certainly assuming that's not why we're here. So we have to be bold, which is the second point separate from data I wanted to raise. We have to be bold in using the data that we collect and assess in advocating in support of the data that has been worked on so diligently to create these results. We're challenged. Now, bold means saying it as it is. Bold means getting more Jamaicans ultimately to know their health status, to promoting physical activity, to looking at our food-based guidelines, you know, the salts, the sugars, the fats, the alcohol, the tobacco. Bold means saying it as it is because we are supported by the data. And in speaking about these uncomfortable truths, using this data to support our position, sometimes we're going to have to challenge the interests of the minority to give support to the interests of the majority. And frankly speaking, that can become even more uncomfortable when you get to that point. And as policymakers, whether at or supporters of policy or lobbyists for policy at the level of the NGOs, departments, the research institution at UWI here, we have a duty to move well beyond the theory and to advocate for those best practices. And that requires a lot of bold action and steps. So in other words, what the latest survey is telling us is that we're moving in the wrong direction. It requires of us, therefore, frankly speaking, to challenge the status quo. We really don't have a choice, because to announce it, to see it deteriorating, and to leave everything as is acceptance of defeat. It becomes an academic exercise to do another survey and spend another 100 million or whatever in another 5 years or whatever, Professor. 7 years it is. I won't be Minister of Health that time, right? But if we leave it as is, or approach the response in a way that cannot generate an adjustment to the status quo, in this case behavior, whether through legislation or moral suasion, then frankly speaking, we are failing. That's a substantial point I'm making. And that's why the need for bold action. That's why the need to challenge the status quo. That's why the need for advocacy is so absolutely important, and why we have to head in that direction. Now, in that respect, we have to embrace partnerships, because as the study participants suggest, no one entity could bring about the type of assessment, analysis, data collection, and dissemination that is going to be on display here today. And one of the things that we have long not done enough of is to be bold to recognize that there's greater self-interest in collective action as opposed to individual individual focus. And it's another critical principle that we would like to see this kind of data being used in a way that generates partnerships, or more partnerships, at the level of dissemination and action and advocacy. So how do we need to approach and what have we been doing to be bold? And why is it that we need the support of all? If we accept that we are challenged with these lifestyle ailments, then some of the actions that we have engaged in, the Jamaica Moves program, which now has to go and will be going into the schools, where obesity levels have doubled according to the school health survey over a 7-year period. And going into schools means food guidelines that have to be established, nutrition policy. Nutrition policy means being bold to say to some suppliers that, listen, you're not going to be allowed in the school to provide these types of foods, the sugary drink being the classic case. Now, how many of us are willing to stand up and to embrace, endorse, and indeed, beyond that, advocate for that type of strong position, which clearly will have implications, will make some people uncomfortable, but frankly speaking, is the right thing to do. And that is a challenge that we will have to take on, and we will have to take on seriously. And even more so, that we have the data to support what we are saying. The issues around alcohol, tobacco, trans fats, so it's not only sugar alone. I don't want the sugar people to think we're beating up on them. We intend over the next year to commission studies around trans fats, to look at sodium, because hypertension, even though sodium is not the only cause, I'm not a clinician, of course, clearly there are some connections there. We, as a ministry, are going to be launching our public education campaign around alcohol. We're developing a paper which will ultimately lead to some policy guidelines. Tobacco, the same thing, mental illness, because we need to speak more about these issues and take them on in a critical and meaningful way. So I guess my comments here this morning, separate from saying thanks, is where do we go from here, having brought all of this together? And I'm saying to all of us here that it only has meaning if we do something about it. Otherwise, it's just a picnic with good coffee. You have good coffee outside, right, Prof? And that's not why we're here. That's not why we committed to this cause. So from data collection and mining to advocacy and being bold while we do it, I charge all of us to take this to the next level, having learned all the lessons from this study. Thank you very much.
Thank you, Minister. I said I viewed it with trepidation, and I'm feeling the trepidation growing. At this time, I would want to welcome Kashima Nelson from St. Albans Primary. Kashima is going to do a dub poem for us.
Hello, my name is Kashima Nelson, and I'll be doing a dub poem. Wait.
Right, from the mouth of our children, we have to take heed. I want to thank you and thank all the speakers who have tried. We have tried to catch up with the time, and I think we have done an excellent job. We have received several pieces of information that's going to take us some time to process, and it has whetted our appetites. Certainly the minister has let out some of the information that has really sparked our interest, and we're looking forward to the next sessions to hear more details. I want to just again say thank you for your attention. Thank you so much to the speakers. We are going to have a break now. Yes. And then we will come back for the first session, which will be chaired by Dr. Beverly Wright. So I just want persons to move outside for refreshments and then to come back in. Take this opportunity to speak to some of the persons involved in the research to get some of the details before we come back to the next session, and to meet and greet persons that you have not seen in a while. Thank you. The next session is to start at 11. It is now 10 minutes to 11. Can we say 11:15? Yes, we'll be back for 11:15.